Hi, my name is Kim. I'm an athlete leader and global messenger for Special Olympics. I'm here today to tell you a little bit about Special Olympics and the Healthy Athletes Program and some of the health disparities that our athletes and other people with intellectual disabilities face. Are you ready? Let's go! Special Olympics, founded in 1968, is the world's largest sports organization for people with intellectual disabilities, or ID. Its mission is to provide year round sports training and athletic competition in a variety of Olympic type sports for children and adults with ID. This gives them continuing opportunities to develop physical fitness, demonstrate courage, experience joy, and participate in a sharing of gifts, skills, and friendship with their families, other Special Olympics athletes, and their communities. Special Olympics Health focuses on the holistic well being of our athletes and applies lessons learned from our work to help improve the health of all people with intellectual disabilities. This initiative came about after Eunice Kennedy Shriver, Special Olympics founder, was seeking health care for her sister, Rosemary. When she saw how many resources it took to find her sister adequate care with a qualified professional, she realized the challenge facing those with ID and knew she had to help. People with intellectual disabilities are often excluded from the existing healthcare system. This is due to inadequate reimbursement for providers and limited training opportunities. Their cascade of disparities include a higher prevalence of adverse health conditions, less access to health promotion programs, inadequate attention to care needs, and inadequate access to quality healthcare services. In 1997, Special Olympics Healthy Athletes began offering free health screenings and education to Special Olympic athletes in a welcoming, fun environment. Since then, we have delivered over 2 million free health screenings and trained more than 280,000 health professionals and students to treat people with ID. Moreover, Special Olympics programs have been able to expand their reach of healthy athletes by offering 123,896 screenings since 2016 in new locations or in new disciplines. We offer health screenings in 8 disciplines: MedFest, History and Physical Exam, Special Olympics Lions Club's International Opening Eyes, Vision, Eye Health, Healthy Hearing, Audiology, Special Smiles, Dentistry, Health Promotion, Prevention and Nutrition, Strong Minds, Emotional Health, Fun, Fitness, Physical Therapy, and Fit Feet, Podiatry. Despite a mistaken belief that people with intellectual disabilities receive the same or better health care than others, they typically receive substandard care or virtually no health care at all. For every 10 athletes on a Special Olympics team, 2 have never had an eye exam. 4 need a new prescription for glasses. 2 have potential hearing loss. 4 have untreated tooth decay, and 1 to 2 are in need of urgent dental care. 2 to 3 have low bone density. 6 are overweight or obese and at risk for chronic health conditions. 5 have problems with strength, and 6 have problems with flexibility, placing them at risk for injury. A big problem when you're trying to play sports. 5 have at least one skin or nail condition. The impact of these screenings on the health and wellness of Special Olympics athletes around the world is significant. Healthy athletes have discovered undetected health problems, alleviated pain, and provided health services that otherwise would not be available. Healthy Athletes is not only a program for athletes, but through training and hands-on experience at screenings. It is a program for healthcare students and professionals to increase knowledge of best practices in caring for and communicating with people with intellectual disabilities. Notably, trained healthcare providers demonstrate improved awareness on self-efficacy in providing care for and communicating with patients with ID. After completing training, 72% of trainees strongly agree that they are confident in their ability to provide health services to people with ID. 74% of trainees strongly agree that they are confident in their ability to match their communication style to the literacy level of different patients. Nearly 100% of trainees reported that they plan to provide follow up care to athletes with referrals. While the Healthy Athlete Screening Program is effective and beneficial, our broader vision is for the inclusion of all people, including people with intellectual disabilities, in mainstream health policies and laws, programming and services, training programs, research, and funding streams. You can help by making an inclusive health pledge, advocating for courses at your health program on the ID population, or taking a training on our online portal. Also, when Special Olympics in person events resume, and they will, volunteer with your local Special Olympics Healthy Athletes program. This is a unique opportunity for students and volunteers to get hands on training with the ID population. All of us athletes would love to see you there. We are a friendly bunch. Don't bite, and we just may talk your head off about the gold medals we've won at tournaments. Oh, and let me tell you how I benefited from the Healthy Athletes program. I have had my eyes checked and gotten sports goggles and glasses. The Special Smiles program gave me a mouth guard. Physical therapy students checked my flexibility and gave me exercises to improve it. And the podiatry students looked at my feet. All of that for free. Visit www.specialolympics.org/health or contact your state Special Olympics program to learn more. Bye.